Now we are going to see about the monkeypox virus. Under the topics introduction, clinical features, transmission, investigation, treatment, prevention, and vaccinations. Introduction: monkeypox virus is also known as MPXV. It is a double-stranded DNA virus which is derived from orthopox virus, which is in pox viridae family. It also includes variola, cowpox, vaccinia, and other viruses. Two genetic clades of viruses has been found as clade 1 and clade 2, and clade 2 has been became an outbreak in 2022. And this monkeypox virus was first discovered in monkeys and then developed in humans. First discovered in monkeys in Denmark 1958. First discovered in Democratic Republic of Congo in humans 1970. The global outbreak occurred in 2022, and WHO has raised in global concern in 2024 August. Transmission occurs through person to person transmission, animal to human transmission, transmission through contaminated objects. This monkeypox infection, which is primarily in rodents and primates, which transfers to the humans through direct contact with animals, animal bite, animal scratch, meat consumptions, and during stunting, skinning, trappings. And person to person transmission occurs through direct contact or infectious skin, or through other lesions such as in mouth and genitals, through contaminated objects like clothing, linens, and through sharp injuries in healthcare workers or in community settings such as tattoo parlors. This is just how the virus gets into the circulation. Next, we are going to see about the clinical features. Clinical features usually begin within a week but can start 1 to 21 days after exposure. Symptoms typically last us 2 to 4 weeks but may last us longer in someone with a weakened immune systems. Common symptoms like rash, fever, sore throat, headache, muscle aches, body pain, low energy, and swollen lymph nodes. Typically, the fever, muscle ache, sore throat appears first, and then rash appears on the face and spreads all over the body, extending to the palms and soles, and evolves over 2 to 4 weeks in stages like macules, papules, vesicles, pustules. And the lesions dip in the middle before the crusting over and then fall off. Lymphadenopathy is a classical feature in this monkeypox, and some people can be infected without developing any symptoms. But in 2022 outbreak, it was different. Like rash appears anywhere first and appears sometime with other symptoms, and it may appear first in other areas other than first in face. So that's it. These are the rashes. First appears to be macule, papule, and vesicles, pustules, and crust. These are the four stages going through. And below that, it shows that how the lesions dip in the center before crusting over, like early vesicles, small pustules, and then umbilicated pustules. Like it starts dip to in the middle, ulcerated lesions, and then crust, and then the crusts fall off. Diagnosis: the DD is so difficult to diagnose this because it shows same as chickenpox, measles, bacterial infections, scabies, herpes, syphilis, like other sexual transmitted diseases. It all appears to be as same skin infections, and in sometimes alternatively in child it may appear along with chickenpox. We can't differentiate from that. So we are PCR is an investigation of choice in this. PCR, the specimen collected is skin specimen from the rash, or through the fluid or crust through vigorous scabings. In absence of skin lesions, oropharyngeal, anal, or rectal swabs can be taken. Generally, testing blood is not recommended. It doesn't differentiate the viruses. Antibody detection method can be differentiated, like herpes to syphilis. Like it can differentiate from different diseases, but it can't differentiate between the orthopox viruses like chickenpox, smallpox. Vaccination. Vaccination should be given 4 days of contact with someone who has monkeypox virus, or within up to 14 days if there is no symptom. The high risk population who must get vaccinated or sexual workers who had exposed to monkeypox virus in the past 2 weeks, and who has been gone to the cities where the monkeypox exposure is great, and health workers at risk of high exposure because they are facing the monkeypox virus first, and men who have sex with men, people with multiple sex partners. Now we are going to see about the vaccinations given in subcutaneous or intradermally, and below 18 years it must be given in subcutaneous given on back of upper arm, intradermal forearm or other areas including upper back just below the shoulder blade or skin of the shoulder above the deltoid muscle. Okay, and these vaccines must not be given if there is allergic reactions like anaphylaxis in the first dose, and self-care and protection is must. Most people will require within 2 to 4 weeks. And Genios vaccine is a vaccine approved in United States in this outbreak, and 2022 it has 3 vaccines approved by the United States. The common side effects like of all vaccines, like pain, redness, itchy on the spot where vaccinated, fever, muscle ache, tiredness, nausea, headache, chills. These may appear generally when the vaccine given, and this doesn't mean that the patient gets more severe sick. Prevention of spread of infection, like the patient must be quarantined or stay at home. Wash hands often with soap, water or hand sanitizer, especially before or after touching sores. Wear a mask, cover lesions when around other people until rash heals. Otherwise, keep skin dry and covered. And take sitz bath or warm baths with baking soda or Epsom salts for body sores. Use salt water rinses for sores in mouth. The treatment given or antiviral drugs and supportive treatment. Trichoveramate is the drug of choice, which was given under the study of trichoveramate for pox virus. Separate investigation was a study was given, and through the oral dosages like 40 to 120 kg 600 mg BID Q 12 hours, more than 120 kg 600 mg TDS Q 8 hours, IV dosages 35 to 120 kg 200 mg IV Q 12 hours, more than 120 kg 300 mg IV Q 12 hours, and generally 200 mg per 20 ml. And other than trichoveramate, brincidovir is used when trichoveramate cannot be used. It should not be used simultaneously with Cidofovir. Cidofovir and brincidofovir is typically the same, but Cidofovir causes many side effects. Cidofovir given less commonly as it shows more side effects, and it should be given concurrently with normal saline and propionate. Vaccinia immunoglobulin intravenous is given in severe monkeypox virus. And monkeypox virus severe complications or ophthalmic conjunctivitis, corneal ulceration and scarring, neurologic is confusion seizures, encephalomyelitis, and through cardiovascular, myocarditis, pericarditis, rheumatology, acute arthritis, synovitis, obstructions, most often in lungs or GIT, secondary to ulcer-related strictures, severe lymphadenopathy, edema of surrounding tissue, sepsis, hemorrhagic shock, death. The summary, the generally the monkeypox in short. Monkeypox is a viral illness which is derived from orthopox, Poxviridae family. Two clades, clade 1 and clade 2. Most common symptoms: skin rash, fever, headache, muscle ache, body pain, low energy, swollen lymph nodes. Transmission occurs through humans through physical contact with someone who is infectious, or with contaminated materials, or with infected animals. The investigation of choice is PCR. The specimen is skin. If this skin lesions are not there, it should be taken from oropharyngeal, anal, and rectal swabs. And the treatment is supportive care, trichoveramate, and other therapeutic management. Vaccines, it has two dosages, 4 weeks apart. It is given subcutaneous or through intradermal. And the vaccine, I forgot to say, the vaccine takes effort only after 2 weeks after the injection. That's it. Thank you.